Today we are going to learn about preparing and maintaining patient examination areas. And there's two reasons for this. One is to maintain a professional appearance for the patient and for the physician, and two is for the septic technique and to make sure we keep everything under infection control. So you want to make sure you maintain, disinfect, and clean for the next patient coming in. Okay, let's get started. When walking into a patient exam room, the first thing you want to do is be very careful. Do not go in and immediately start grabbing everything up, because you will have hidden surprises, usually from the physician, such as a syringe, a razor, anything's possible. Be very careful. Pick it up from the very end, take it immediately over to the sharps container and drop it in. Make sure it went in all the way. Shake it if you need to. After you make sure that all of the sharps have been picked up and there aren't any more in there, then you can start rolling the paper up. Throw that into the trash can. Now, something everybody seems to forget is the pillow with the pillowcase. Take the pillowcase off. Somebody's head just touched that. That's gross. You want to make sure that you clean the table. You're going to use a 10-1 bleach solution, 10 parts water, 1 part bleach. You don't need to spray a whole bunch on there, but just enough to get it coated. When you are cleaning and wiping this down, there's no particular order or motion that you need to do this in. You just want to make sure you get it all cleaned off, all dried off. You don't have to be particular about the order and how far and how wide or going back over, not like when you're using alcohol on an arm. Just make sure you get it dry. The last thing you want to do is put clean, dry paper on top of a wet surface area. Make sure you get all your nooks and crannies. Throw that in the trash before you put on clean paper and a clean pillowcase. Change your gloves. Now that we got clean gloves on, time to put on some clean pillowcases. Most of the supplies you're going to need are going to be kept underneath your exam table, such as your pillowcases, your patient gowns and drapes. If they're not under there, they're probably within the cabinets there directly in the exam room. Not all pillowcases are used in every doctor's office. Some doctors don't even use pillows. In case they do, you always want to change the pillowcase. If you don't, anything the previous patient had, such as germs, was left there. Always make sure you're going to put clean paper on. Clean paper indicates that table has been sterilized, disinfected, and that it's ready for the next patient. Paper can go over the pillowcase, under the pillowcase, it doesn't matter, whatever your office wants. Off to the countertops. Now we have to clean exactly where the doctor threw everything. Pick up all cotton balls, all trash, everything you can possibly find. They throw everything everywhere on the countertops. They kind of just wreak complete havoc. They don't have time to be proper. They don't have time to put things away. That's your job. Always make sure that you take the speculum off of the otoscope. These are not reusable. They need to be thrown away. Make sure this has been turned off. Make sure it still works, because they sometimes leave that on. You want to make sure everything is organized. After you get everything cleaned away, you want to use a bleach solution, a 10-1 bleach solution. Wipe down the countertops and wipe down all of the tools and instruments that you used. You want to make sure you get all germs that could cause an infection off of the countertop. It really is okay to use the same wipe when cleaning down the instruments that are on the countertop. You clean them off first, there might be goop. Second of all, you can use this because it is a 10-1 bleach solution and it immediately kills germs right on contact. After wiping that down, making sure all of your instruments, everything is put back into place the way the doctor's going to expect it, throw that away, take off your gloves, wash your hands, and you're done. This is something you're going to be doing every day, up to 30 times a day. When you go into the exam room, go in slow, start slow, because you want to make sure there are no sharps out there that are going to just surprise you. Go slow, but you also need to hustle, guys. You're going to have about 3 minutes in between every patient to get this done. Remember, go slow, hustle, be thorough so you find all sharps in all the nooks and crannies. And finally, every office, they're going to be different. So make sure you find your lead MA and your office manager. Ask them, what do they expect? What do they want from you? How do they want the rooms cleaned? I'm Kimberly Dickinson. Thank you for being with us today.